Drugs were never designed to cure you. It's 100% true, and today I'm going to actually prove that. But we really need to start in 1938. This is when a definition was redefined that literally gave Big Pharma a monopoly over your body. And from then on, health has become one of the most profitable businesses in existence. It was called the Federal Food, Drug, and Cosmetic Act, where they redefined the word drug.
In the Food, Drug, and Cosmetic Act, the term drug is defined, and it's defined as anything that is intended for use in the cure, treatment, prevention, mitigation of disease. What if you drink prune juice and you drink it because you are suffering from chronic constipation? Do you regard prune juice as a drug? Well, the FDA does, because the FDA has defined it as a drug to protect the drug companies from competition.
If a natural remedy or a plant or an herb or even a food does anything to improve this abnormal state of your body, it is now classified as a drug. So if someone makes a claim that garlic can actually help your cholesterol and reduce risk of a heart attack, for example, and they're selling garlic, they're going to get in trouble. And now that they're using a disease claim, that garlic is no longer just this thing you put in your food to make it taste better. It is a drug.
Even if it's something we eat every day.
And I need to define disease first before I get into this. Disease is any abnormal mental or body condition. And in 1900, we had less than 200 diseases. Now we have over 17,000 diseases.
It's been a real barrier to innovation, to the communication of truthful information to consumers. I mean, without that, you'd be able to go to the grocery store and read all about the various nutrients in foods and have little things that are saying, hey, this has more vitamin C and this will reduce your risk of disease in these areas. And you'd be able to see that at the point of sale and be able to guide choices with that. The American people have been deprived of truthful information essential to their health.
Even for normal conditions, right? You have, if your attention is not that great, you have attention deficit disorder. If you had a loss of a loved one and have grief, you have adjustment disorder. If you're shy, you have social anxiety disorder. If you're nervous before a speech, you have performance disorder. I think I had that one. And you don't even have to be sick to have a disease. You could have a risk factor, like let's say your cholesterol is high. High cholesterol is not a disease, but that then is heavily treated, right, with drugs. Prediabetes, you didn't even get diabetes yet. You have prediabetes. That's considered a disease.
There is no other industry that has been given as long a patent life protection for their drugs than the drug industry. There's no other industry in the country that has the federal government serving as its patent protection police.
So disease really has turned into a big business, and it's all about creating awareness on all the different types of diseases that can be out there and getting you to buy into that, and then getting the doctors to treat them with medication.
Ordinarily, if you have a patent, you have to go protect it yourself. With the drug industry, the FDA protects their patents.
It's modeled perfectly to keep this big pharma machine going on, and the whole thing is policed by the FDA. So the FDA really is protecting the drug companies big time.
The founding fathers, when they created the First Amendment to the Constitution, intended there to be no power whatsoever by the federal government over speech and press. And so what we have is something that was even forbidden under the Blackstonian law that precedes the American Constitution and was a basis in part for it. In fact, the Blackstonian law is embedded within the First Amendment, forbids prior restraints. Now, prior restraints are when the government says, you may not talk about a particular topic unless we approve it. That's a prior restraint, and that's what they do in the case of nutrients. They say, okay, yeah, you have proof that a nutrient reduces the risk of disease, but you can't talk about it unless we, the United States government, the Food and Drug Administration, say you can. Now, that's a prior restraint, and that's what the founding fathers forbade. They said, no way, we're not going to let the government be a super editor and deprive you of your right to speak.
And this is why when I do videos on all these natural remedies that help diseases, I am never selling anything, okay? Even if there's legitimate research. Now, I'm just going to go through this really quickly. You've got to hear this. I'm going to go through 7 natural remedies that not just compare to a drug as far as effectiveness, but work better based on randomized control studies. St. John's wort works better than SSRIs for depression. They tested it side by side, 251 patients with moderate and severe depression, 6 weeks. So there's 70% results for St. John's wort versus only 60% the drug. But the side effects were much greater for the drug than St. John's wort, of course, because the SSRIs produce sexual dysfunction and all sorts of other issues. Here's another one. Red yeast rice worked better than statins. So this was a meta-analysis of 15 randomized control studies for cardiovascular risk reduction. These were the results. A 45% reduction for red yeast rice versus only a 30% reduction for statins in long-term trials. Plus, the side effects were less than half. Here's another one. Black cohosh worked better than hormone replacement therapy. Again, another randomized control study of 89 menopausal women over 12 weeks. There was a reduction by 80% for the black cohosh and only a 60% reduction for hormone replacement therapy. Berberine worked better than metformin for type 2 diabetes. This was a randomized control study of 116 type 2 diabetics over 3 months. Showed berberine reduced A1C, that's an average of blood sugar, for 3 months by 12% versus metformin was only 11%. But the cool thing is there was less side effects with the berberine than metformin. Next one, lavender oil. Better than lorazepam for anxiety. This study involved 221 anxiety patients over 10 weeks. Showed lavender oil reduced anxiety scores by 16 points versus lorazepam only reduced it by 14 points with only 1/5 of the side effects. Interesting. Here's one. Saw palmetto better than tamsulosin for lower urinary tract symptoms. In a randomized controlled trial of 140 patients over 48 weeks, these natural herbs reduced the symptoms by 5.8 points versus the drug only 5.2 points with much less side effects. And when we talk about the reduction of points, we're talking about a urinary tract symptom score, which indicates improvement. And then the last one I want to talk about is wormwood. It worked better than mesalazine for Crohn's disease. This is a inflammatory colon problem. Wormwood showed a remission rate of 80% versus only 65% for the drug. But here's the big problem. It doesn't matter if all of these natural remedies showed some very credible research that it can work better than a drug or comparable to a drug. It doesn't matter.
If you want to say that anything that is a nutrient reduces the risk of disease or treats disease, you cannot say it. It's forbidden. If you really want to say it, you must petition us, present the evidence, and then we'll decide whether or not we think you should say it.
Why? Because the law says that if it improves disease, it is classified as a drug. 40 to 70% of all drugs originated from nature, or a microbe, or marine life. But then this ancient remedy that stood the test of time, that's worked for thousands of years, is now considered folklore or quackery or unscientific or unproven. You just found that an extract actually can help or create an effect with a disease, but now you're discrediting where it came from. But I think it might help to understand what a drug really does. Most drugs, not all of them, but most of them inhibit an enzyme. Now, you probably can't see this entire chart, but this is a huge diagram of biochemistry in your body. All the different biochemical pathways that have enzymes that allow food to be converted to fuel, to allow food to be converted to raw material, to make body tissue. And this is basically the mechanics of what's going on in your cells. And so what a drug does is it'll inhibit just one little enzyme in this biochemical factory. Now, let's say, for example, we take a drug that inhibits an enzyme called 5-alpha reductase. The effect that creates when you do that is it helps to reduce the enlargement of the prostate gland, and it helps you grow your hair back. And that drug is called finasteride. So in this example, testosterone normally converts to a more powerful form of testosterone called DHT. And if there's too much of this, okay, then you get enlarged prostate. Then you get hair loss. So the whole goal is to inhibit this enzyme. So therefore, we block this biochemical pathway, inhibiting this enzyme. Sounds pretty cool, right? But the question is this fixing the real problem? No. Is it correcting anything? No. It's just stopping one little enzyme in one little pathway. It does nothing with the underlying cause, because the real question is, why do you have this increased DHT in the first place, right? That's never ever addressed. And this is why when you start taking a drug, you never really come off the drug, because it never corrects anything. You just keep taking it over and over for the rest of your life. I mean, I would love to just have you ask your doctor and say, how long do I have to take this before it corrects it? Because it doesn't correct it. This is why drugs don't fix anything. They just patch things up enough to reduce some of the symptoms and manage those symptoms. That's pretty much all they do. But here's the problem. The drugs are compounded with more strength, okay? So it's gonna, with aggressiveness, really inhibit this enzyme compared to the natural remedy that they developed it from. So the problem with the drugs is they have more side effects than natural things. And that's why they have this massive problem called post-finasteride syndrome, where you're basically having all sorts of complications with the drug because you potently block this enzyme, and that comes with a package. Atrophy of the penis, erectile dysfunction, you lose your pleasure from sex. I'm going to tell you right now, every single medical condition has a root cause, but that's kind of been pushed off to the side, because if it was known or aggressively went after, Big Pharma would really take a hit. The number one reason why your DHT is too high is because you have insulin resistance. Too much insulin raises androgens, especially this type of androgen right here. This is a powerful form of testosterone. This is why men that have insulin resistance tend to lose their hair, and also they have enlarged prostate. And of course, insulin resistance comes from too many carbs, eating too frequently, eating junk food. Another cause of this would be high levels of chronic stress that can increase cortisol. Or liver problems can do it, because if you have a liver problem, you'll have more free testosterone to then turn into this, because one purpose of the liver is to protect you against too many hormones, okay? So there's a buffer in there that protects you. Another cause of this would be low zinc in the body, because zinc naturally controls this and keeps this at a normal level. And how many people are deficient in zinc? A lot of people. But the problem in medicine is when you go to the doctor, they're going to treat the symptom. They're going to omit these lifestyle changes. They're not going to focus on root causes. That's not what it's about. So the question is, why aren't these amazing natural remedies being promoted to help people with all their conditions? Because they have their hands tied. They can't. Natural remedies, if they help the body, are considered drugs in the classification of drugs, and that would have to go through the FDA approval process and take billions of dollars, which is not going to happen.
Yes, we're going to try to get the FDA to recognize that its own rules are unconstitutional. This will be an uphill battle, but we need all the help we can get. And if we succeed, the market will be deluged with information never before allowed to reach the public about the specific effects of nutrients on disease. And that will save lives. It will increase the number of years of healthy living, and it'll also increase the overall longevity of the American public.
Now, if you enjoyed what I just talked about, you're going to really enjoy something a bit more practical, things that you can actually use to help heal your body naturally by providing the key nutrients that prevent a lot of health problems. This video is about 21 signs that your body needs specific nutrients. Check it out right now.